Hi, today's topic is acute abdominal pregnancy. It's a very important when we see the patients of acute abdomen, and these are type of patients are very troublesome. When to diagnose, and how to proceed, and what has to be done. It's a really important point. As defined in the 27th edition of Sedgman's Medical Dictionary, that acute abdomen, any serious acute intra-abdominal condition attended by pain, tenderness, and muscular rigidity, for which emergency surgery must be considered. So acute abdominal pregnancy, we should think many more things. Acute abdomen, it presents with the pregnancy, it has many possible causes. Clearly, the case of pregnant patient with acute abdomen is a clinical scenario that overlaps specialties. It's not only the obstetrician job, it's maybe surgeon's job, the gynecologist, and all the specialists of the maternal fetal medicines are dealing with the challenging situation. I'm sure that everybody practicing OBGYN, any patient who comes with acute abdomen during pregnancy, it's a really troublesome. There are so many causes that are incidental to the pregnancy. So we can distribute it into the gastrointestinal causes. It can be due to appendicitis. It can be pancreatitis, which is a peptic ulcer. It can be hepatitis. It can be bowel obstruction. It can be pancreatic pseudocyst. It may be a toxic megacolon. It's a mecal diverticulitis, herniation, bowel perforation, and gastroenteritis. So these are the main causes. But the causes incident to the pregnancy may be due to the genitourinary causes. First, I talked about the gastrointestinal. These are the genitourinary causes of acute abdomen. Number 1, ovarian cyst rupture. Number 2, adnexal torsion. Number 3, there can be a ureteral calculus. Patient with acute abdomen come in the morning. She is pregnant and a sudden pain. We get worried, we get troubled. There are chances of ureteral calculus. And if there is a morning pain or something like that, then the rupture of renal pelvis. It appears to be a very unusual condition, but if it comes, it's really the acute abdomen, the havoc, and everything. Then the urethral obstruction is another point for the genitourinary causes of the acute abdomen. Now, these are the vascular causes of acute abdomen. It can be a superior mesenteric artery syndrome. It can be thrombosis or the infarction. It can be a ruptured visceral artery aneurysm. It's a very unusual conditions I'm talking about, but we should know when the patient of acute abdominal pregnancy comes to us. There can be a splenic artery aneurysm. So we have divided into 3 causes. One is the gastrointestinal, one is genitourinary, and the vascular. Now, these are the other causes or the incidental during pregnancy. These are the respiratory causes of acute abdomen. Patient may be having pneumonia or a pulmonary embolism. Another, there can be an intraperitoneal hemorrhage. The intraperitoneal hemorrhage, because of the splenic rupture, there may be the history of trauma. We should take the proper history of the trauma for the acute abdominal pregnancy is very, very important. Acute intermittent porphyria, diabetic ketoacidosis, and sickle cell disease. These are also the incidental during the pregnancy. Now, these are the causes associated with pregnancy that we have. They were the incidental and they are associated, can be with acute pyelonephritis, acute cystitis, acute cholecystitis, acute fatty liver of pregnancy, and rupture of the rectus abdominis. See the fun that we come to the patient comes with too much extended abdomen, previous to C-section or something. It can be chances of the rupture rectus abdominis and torsion of the pregnant uterus. These are also important, and conditions resulting from pregnancy that causes acute abdomen in early pregnancy. As we all know, it's ectopic pregnancy, septic abortion with peritonitis, acute urinary retention due to the retroverted gravid uterus, all the prolapsed uterus and everything up to the 12 weeks or the 14 weeks. Patient comes with the acute abdomen because of the urinary retention and to the retrograde gravid uterus. Now, these are the associated conditions with the pregnancy, and they may be an acute abdominal pregnancy as a red degeneration of the myoma. I'm telling you, I myself has been suffered of the red degeneration of myoma, and this is not a good condition. And the torsion of the pedunculated myoma, then can be placental abruption, Kawita, and the HELP syndrome. We all talk about it. That's a hemolysis, elevated liver function, and a low platelet syndrome, and a spontaneous rupture of the liver. Uterine rupture, all of us know, is the most dangerous and most troublesome, and a chorioamnitis. These also come with a pain. So why it's so important? Why we are worried about everything? So history is so much important. what is the time of the onset, what is the duration, what is the intensity, how the character of the pain and the associated symptoms, and establishing the gestational age early in the evaluation is early because it's like differential etiologies changes with different gestation. So we should be worried about if the pain is in the first trimester, pain in the second trimester, or the pain in the third trimester, we should be worried about. The diagnostic imaging, always the ultrasonography is the best because frequently we find out the gallbladder, the pancreas, the kidney, and we can evaluate easily. But there are the limitations when the later stage of gestation are there. It has got the graded compression with the diagnostic aid of appendicitis, and the size of graded uterus may limit the approach to pregnancy. So the sensitivity of MRI imaging for acute appendicitis was 80% compared 20% with sonography. So sonography is essential for the fetal evaluation. We should establish the gestational age, viability, congenital anomalies, amniotic fluid volume, fetal well-being. This information may become critical later in the management of gravitation in abdomen when the decisions regarding the because so important in all these points. What will be the mode of the delivery? What will be the use of propolis? Steroid should be given, not to be given, when to deliver the baby. So acute abdomen is very, very important. And the radiography and computed tomography, they have got relationship, but ionizing radiation evaluation of patients pregnant, source of anxiety, and practicing clinicians, it's little different for the effect. And there's the procedures for this, and there can be abnormal for if you want to do the radiography for diagnosing the acute abdomen. There are chances of exposure in a different way. So the way the MRI has got the role, and I see on just says the acute abdomen, we should do the MRI. Now, if we have diagnosed something, then what should be the timing of the surgery? What are the chances of this of preterm labor? What are the spontaneous loss? What are the medication we can give? What is the emergency surgery? These all points should be consideration. Is there anything like a laparoscopy we can do during pregnancy? Yes, we can do. In the past, pregnancy was considered contraindication for the laparoscopy, but multiple reports show laparoscopy for the diagnosis is also important, and it's not that troublesome. It can be done with with guarded everything. Use of capnography during laparoscopy in the pregnant patients is recommended. Potential injuries to the gravid uterus should be worried. How much CO2 should be given? All these points are during this thing. An advantage is also there. It can be diagnosis and surgery can be done of many conditions. Now, why we are worried about acute abdomen? That's an obstetric concern. It's a preterm labor and a delivery, and the prophylactic effect of tocolysis remains unproven in this patient, and tocolysis should be administered with care. There are several causes of non-OBGYN appendix. I'm not going into detail, but telling you that we have to do it the way and we can treat it. Cholecystitis is one, appendicitis is one, pancreatitis is another important cause. So how to diagnose is how to differentiate what is the muscle guarding, what do we do, what are the things. And the intestinal obstruction, we take the right history, work up and a planning. Uterine is all the stones and everything is another important thing. When to put a stent. Rupture of the ovarian cyst is an R domain, and we should treat it in a nice manner, and we should be able to diagnose by peritoneal signs, tenderness, and a guarding. So rupture ovarian cyst is another important. Another is an Adnexal torsion. That also we should be treated. Sometimes the dermoid and everything are there. So for the surgical therapy, Adnexal, sometimes we have to operate on the Adnexal muscle. Degenerating myoma is another bad thing, and it should be diagnosed rightly and when to given, what treatment should be given during the pregnancy are important. And these are the few points are very, very important. Placental abruption, we all know. Abruption, we all know. So these are the points, and we should be worried about all those points during the pain, during the pregnancy. So again, the uterus rupture is another big cause. We should do the right diagnosis. Sonography is useful, and treatment consists of emergency cesarean delivery, and all those points are very, very. These acute abdomen is one of the most important cause for one of the maternal mortality and morbidity also. So it workup, and hepatic rupture is another. So I have given a big list. Even the ruptured ectopic is there. So these are the important causes, but the rare causes of the rupture of visceral aneurysm and any vessels may be there. So